Welcome to Focal Points. Today, our special guest is Dr. Raphael Lataster, and he has completely debunked the nonsensical claim that the COVID vaccines have saved like 14 million lives or something ridiculous based on a study out of the Lancet by Watson and colleagues. And so he's going to tell us why it's not the case that these injections saved that many lives. And so doctor, why don't you tell us a bit, give us a brief introduction about yourself, and then we'll dig into this critique you published.
Yeah, sure. Thank you for that kind introduction, Nicholas. I was sort of forced into this. I was minding my own business. I was an academic, a philosopher, dealing in analytic philosophy, logic, epistemology, things like that, looking at the big questions, existence, all of that. And I was working part-time at a children's hospital, the largest children's hospital in Australia, and I was fired. COVID happened, and I was fired because of the vaccine mandates. So I had a lot of problems with that, dealing with that, and I decided to fight it. I found out there was a legal way we could fight that and win. And as part of that, I started doing some research. It's very difficult because of my circumstances right now, but I managed to do some research, and bit by bit, I started getting articles published in medical journals. And my PhD is not in medicine. I do plan to do one later on. I have a Bachelor of Pharmacy. I have worked in health, and I was working in a hospital at the time. So I am quite aware of how science is supposed to work, medical science, pharmaceutical industry, and so forth. And I've managed to actually get published in proper medical journals. And while I was presenting on this, Dr. Robert Malone invited me to America, and I managed to speak in front of for one of the Senate hearings with Senator Johnson. And I was speaking about some of the research about how the COVID vaccines, the effectiveness and the safety have been exaggerated from the beginning in the clinical trials, in the observational studies. And Senator Johnson asked me about this study, Watson et al. And I thought I said, yeah, it's a pretty crappy study. And I thought I should actually do a proper critique of it. So here we go. More than a year later, we finally got it published. And I think it's probably the most thorough critique you'd find of it out there, at least published in a journal. And there's clearly a lot of problems. There's clearly a lot of problems with this study that's claims that's 14 million, maybe even 28 million saved by the jabs in 1 year. So pretty big claims. And yeah, I think I've done a lot to show that can't possibly be true.
So this is the study that claimed that, right? So what did they do wrong? What kind of tricks did they employ that
Yep.
led them to this number?
Yep. So straight off the bat, they are using figures for efficacy or effectiveness that come from clinical trials, from later observational studies that people like Peter Doshi and myself showed in peer-reviewed research, they are not accurate, right? We showed that because of things they do, such as ignoring what's happening in the partially vaccinated. So, you're only considered fully vaccinated until, say, 2 weeks after your second dose. Before that, you're partially vaccinated. In the best case scenario, that's ignored, what happens in the partially vaccinated. So if they're getting cases of COVID, or in the worst case scenarios, they're actually added to the unvaccinated. So you end up getting this huge exaggeration of efficacy, effectiveness, and also safety. I found that in some cases it actually applies to safety as well. And we showed in research, Peter Doshi, he's one of the editors over at the BMJ. His team showed that you could make a completely ineffective vaccine look 48% effective when you do this. And I showed it's actually worse than that. It's 65% thereabouts if you actually add those forgotten cases onto the unvaccinated side, which does happen in certain cases. So that's the first problem. They're using exaggerated figures of efficacy and effectiveness. And as for safety, they're not even bothered with safety. I don't know how you can claim that something is worth the risk when you're not actually looking at the risks. So that's the first problem, straight off the bat. And there's many, many more problems.
So straight off the bat, something's gone haywire.
Straight off the bat. Another huge problem.
Yeah, go on.
Another huge problem is static vaccine effectiveness. So once they have the figure, so they're making a model basically, right? They haven't really looked at, right, how many people are dying who are vaccinated, who are unvaccinated. Are they dying from COVID? Are they dying from other things? No, none of that. That's too much work. What they've done is made a model, right? And models, well, models aren't reality, and it's all dependent on the GIGO principle, garbage in, garbage out, and they're putting a lot of garbage into this model. Another bit of garbage is that they're assuming static vaccine effectiveness. Now, that's an absolute joke. We know, I mean, the mainstream knows. We're a bit outside the mainstream, aren't we? But the mainstream knows the vaccines, they don't keep their effectiveness. In fact, the effectiveness rapidly decreases, even up to zero within a few months, even for death. And as you know, it's worse than that. We even get negative effectiveness. None of this is discussed in this study. They have their figure. It's 95% from the Moderna trial, whatever it is.
So
Delta
they really
comes in.
keep 95% the whole time. Like that. How long do they model that for?
They do have smaller figures that they assume for other strains like Delta. I think it's 60 something percent, but still it stays that way. It's static. And we know that's not the case. Even in the mainstream, we know that's not the case. That's why they keep telling us to get boosters, right? They admit the jabs aren't very effective. They write whatever effectiveness there is, it's gone within a few months. So huge problem with the study. And of course, there's more. There's more. So infection fatality rates, right? So one aspect to look at when you're doing this model is, right, how effective is the vaccine? And then another aspect is effective on what, right? So this disease, COVID-19, how deadly is it? Now, I couldn't actually find where they're transparent about what IFRs and CFRs they're using, infection fatality rates, case fatality rates for COVID, but they do reference other articles. And those other articles, they use figures that are really high. They give ranges, right? And it seems like Watson et al. Are using really high figures, but there's no justification. It's just, oh yeah, here's a reference and that'll do. That's not how science works, right? You can't just reference somebody you like and that's good enough. You have to actually say what that figure is. How did they come up with that figure? You need to justify it. They did none of that. And anyway, we know the figures are way too high from the study that they cited, because Ian Eady is very quick into the pandemic. He showed actually it looks like the IFRs are a lot smaller, right? And we know that even more now. The Greek study that came out recently, was it a month or month and a half ago, that showed, yeah, they've definitely been exaggerating. We knew they were exaggerating. They've definitely been exaggerating COVID deaths, and it could be by double or more, right? That was out of that Greek study in one of the Nature journals. So we always knew that problem of the from, was it from COVID or with COVID? We always knew that. In your country, you've had people dying from gunshot wounds. That was counted as COVID deaths. We've had a few automobile accidents in Australia that were counted as COVID deaths. We know that was going on. And now we have at least a frame of reference. So that's another huge problem.
So you're telling me that Peter Hotez's favorite statement, which is that the vaccine saved this millions of lives, is he driving that statement from this paper?
It seems so. I mean, everybody basically knows about this study. And I've been saying in the last few days, I've been saying, if just 10% of the people that know about this study know about this critique of the study, that would be a pretty decent result, relatively. Because obviously a lie just spreads around the world within seconds, and just, it takes years to undo that damage. And here we go. It's several years after the study, and nothing in the media about this study. I've reached out to everybody. I've let the media know. And yeah, pretty much, I mean, we're just relying on Twitter at this stage, or X and Substack and people like yourself to get the word out, because the big journals didn't want to touch it. The mainstream media doesn't want to touch it. It's pretty challenging to get this out there. But they all know about Watson et al. They might not know the name, but that's the one they refer to. I've had friends who were doctors as well. When I've started raising questions about the vaccines, they said, yeah, but they saved millions of lives, right? There was that study. Everyone knows about this study, right?
Right,
So
right. And
huge.
even our government here in America still references and claims the fact that they
Yeah,
saved millions of lives to claim that warp speed was successful. But that's it's just
that's
not
right.
true. It's just based on absolute nonsense. And so you're doing such important work here, dismantling that nonsense. So we can finally say what they're saying isn't true. Because that's their defense mechanism. When we say they've killed a bunch of people, they'll say it saved more than it killed. And so
Yeah.
so tell us a bit. Have you found anything regarding excess mortality recently?
Yeah, so I've actually got another article published a while back on it's in Bulgarian medicine, right? A Bulgarian medical journal. Because Bulgaria, as it turns out, is one of the countries in Europe that's doing quite well with regards to excess mortality. And what's interesting about Bulgaria, just like Romania, is that they're not very vaccinated, right? They didn't vaccinate as much as the other European countries, the US, Australia, and so forth. And they seem to be doing very well now, Bulgaria, Romania, with regards to excess deaths. So what I showed in that article was that excess mortality is correlating with vaccination, right? With COVID vaccination. And I mean, that's a very small, it's kind of interesting article. It doesn't prove anything, but it is interesting. What is much stronger is an article that I've finished and it's going through the motions now, getting rejected at all the major journals, as you can imagine.
Oh yeah,
I believe I've basically shown yes, it's the jab, right?
really?
Without a doubt, I think it's a bit of a smoking gun. So the problem with trying to figure out what's behind excess mortality, you look at what changed. It wasn't just COVID. A few other things changed during these past few years. One is the lockdowns, which you can expect will cause some health problems going forward, and another is the vaccine. So what I did was identify regions where you couldn't come up with those excuses. Oh yeah, that's the Bulgarian Medicine Journal. So I found regions where no, it's definitely the jab, and not just for deaths, not just for excess mortality, also for hospitalizations, for things like cardiovascular problems as well. Suddenly they just skyrocket as the jabs come out, and you can't blame COVID and you can't blame the lockdowns. It's clearly the jab. So looking at getting that published soon. Now that has almost zero relevance, funnily enough, to this study here, to Watson et al. And my critique of it, because they don't actually go through any of that stuff. While they do try and mention excess deaths, they just assume it's all COVID, right? So
Right.
terrible assumption there. As I said, it could be lockdowns, it could be COVID vaccines, it could be maybe something else as well that we haven't thought of. So terrible, terrible work that they've done there. But as part of that, they haven't looked at the potential harms of the jabs, right? And we know that the jabs cause harms. Again, that's in the mainstream. That's not something that we've whipped up by hanging out with Alex Jones or anything like that, right? This is in the mainstream. My government acknowledges 14 deaths from the COVID vaccines. It's much higher than that, but that's what they're prepared to admit. I'm sure in America, you've got pretty good evidence that people have been dying from the vaccines as well. I mean, that's why they basically stopped the DNA jabs, and now it's all about the mRNA jabs, almost the same thing. And yeah, there's other problems as well. We know about the myocarditis, right? I did a little analysis there that was published in one of the BMJ journals, only as a rapid response, not as a full article, that basically showed the myocarditis risk alone overwhelms whatever benefits there are to the jabs in the young and healthy. So at least for the young and healthy, there's definitely no point to taking the jabs. It's the risk definitely does not make up for the benefit. Other way around, the benefits do not justify the risk. The risks are greater just for myocarditis alone, just for that one side effect. Right,
Right.
that's how poor it is. If you look at the UK data for the number needed to vaccinated for young healthy people to prevent one serious COVID hospitalization, it's in the hundreds of thousands. It's terrible. But yet every few thousand people taking the jab, you're getting myocarditis, right? And how many people are getting subclinical myocarditis? How many people getting other problems with the kidneys and whatever else? Yeah, it's not worth it for young healthy people at the very least. But there's even more. There's even more. I mean, there's one more thing. We're going to run out of time, but there's one more thing I just have to mention about Watson et al. That's a huge, huge problem, and that's the conflicts of interest. right? There are a lot of financial and political conflicts of interest here. So you look at the people who wrote this study, who did the modeling, who wrote the article, and there's a few ties to vaccine manufacturers, first of all, and there's also ties to the World Health Organization and the Wellcome Trust and our old friend Bill Gates, right? The expert who's not the expert. We're meant to trust the experts, but for some reason, Bill Gates is thrown in there while we're meant to ignore all the people with PhDs who are speaking out about this stuff. But yeah, Bill Gates is involved. And there's political conflicts of interest as well, which is really alarming. For me, the biggest is that the boss of the research group, this person is not listed in the article, but the boss of the research group that carried out this is Neil Ferguson. Mr. Lockdown, Professor Lockdown in the UK, right, who's been so influential in the lockdowns there and worldwide. He's famous for getting things wrong all the time as well, even pre-COVID. He's also famous for being a massive hypocrite, because the lockdowns that came about because of him, he ended up breaking those lockdowns while having an affair with a married person as well. So not a great guy. You find that a lot with the people behind these studies.
So his flawed modeling led to the lockdowns and claimed that the vaccine saved millions of lives.
Yeah.
Wow.
Yeah. So political conflicts of interest, what you'll see as well. So this critique here, this is part one. It's a 3-part metacritique coming out in this journal. The second part will be on an American study, and the third part will be on the European WHO study and a few Australasian studies as well. And they all have basically the same problems. What you're going to find is they tend to have financial conflicts of interest or political conflicts of interest. So funded by the governments that approved, encouraged, and even mandated the vaccine. So a bit of a conflict of interest there, right? So you'll find this with basically all these studies.
Yes.
Right? And all the problems I laid out here, pretty much all these studies.
Well, just that shit has to raise alarm bells in people's heads, right? Because these are the same guys. Like, we know the Gates Foundation was instrumental in the construction of mRNA factories, distributing them to many countries worldwide. And so of course they're gonna try and claim that they save millions of lives. And now, as you have done in your critique of this paper, you just absolutely shred it apart and show that it's complete nonsense, and they've been basically lying through their teeth. Who claims that these vaccines are 95% effective or whatever high effectiveness just indefinitely? It's just ridiculous. I urge all of our audience to please go check out his Dr. Lataster's metacritique of the Watson et al. Study. It's absolutely crucial in dismantling the claims that have been perpetuated these past few years. So, Doctor, is there anything else you want to tell our audience before you go today?
Yeah, one more aspect of this critique is I have a little section where I lay out other problems as well, which lead to conflicts of interest. So the way science is done nowadays as well. I mean, I went to pharmacy school. I know how it's supposed to go. I learned how science works. I learned how medical science works. And I had a tutor, very popular tutor. He's now the head of the department there. He said that you can never say a pharmaceutical product is safe. And that stuck with me. And during COVID, even if you forget the vaccines, Folkadine happened. Remember Folkadine? That was considered safe for about 70 years until it wasn't. 70 years. And then here we've got these COVID vaccines with just a few months of data. And, they're perfectly safe. Take them. Everyone should get them. Even 6-month-old babies should get them. So there's a lot that's happened. Science has changed. Medical science has changed. And for the worse, recently during the pandemic and a bit before as well. It's very concerning. We've got the regulatory capture, that awesome article in the BMJ that showed that, all around the world, all around at least the Anglophone world, the civilized world, we've got, 90%, 95% of the regulators are funded by the drug companies, by the vaccine manufacturers and things like that. And then you've got the revolving door as well, the revolving door of employees who work at both. And you've got other problems as well. The medical journals where their own editors have admitted that they're basically the marketing departments of big pharma. You've got the paid reviewers as well, paid editors by big pharma. You've got the doctors prescribing medicines and giving out the jabs. They're paid by big pharma. It's just, it stinks to high hell. And I mentioned this one thing as well, that actually, if you look further than that, I have a finance background as well. I used to be a financial advisor. And if you look at who owns all the big companies in America, it's basically all the same people that own all the big companies. So BlackRock, Vanguard, State Street, all those big investment firms, they all own or at least control these big companies like Big Pharma, like the mainstream media, even Fox News, if you could believe it, not just CNN and MSNBC, also Fox News. And they're all owned by the same few big, ultra wealthy organizations that are owned by essentially their investors, which are people like Bill Gates, George Soros, all the boogeymen like that. So yeah, it's very dirty. It's incredible what's been happening these last few years. And I would like to see some good science done. I'd like to see some good logic done. That's my field. That's where I come from. Analytical philosophy, logic. And it's incredible just the sort of what doctors have been doing, what scientists have been doing and claiming as being correct, as being gospel. It's a real shame. And as you pointed out, a lot of people know about this study, Watson et al. Millions of people know about it. It's affected the lives of billions. I'd be happy if just 1 million people knew about microtique, but realistically, everyone that's exposed to Watson et al. Should know about microtique. But it's thanks to people like you that others will get to know about it, sharing it. It needs to be shared on X, Twitter, on Substack, all that, because I have no audience. I can't do this by myself. I've done the research. That's great, but I can't get it out there. I think I've got about 400 followers on X. Yeah, 3,000 followers on Substack. That's it. I've got virtually no audience. So I rely on people like you. So thank you for the opportunity to come here and explain what's going on here. And yeah, so everyone check it out and share it. Don't keep it a secret. I've been doing a lot of interesting research in this area. I've got a lot more to come as well. And don't keep it a secret. Make sure you get it out there.
Well, thank you so much for coming on today. We will be for sure blasting out your critique of Watson et al. We will be blasting it out on all platforms so everybody can see just how much we have been deceived. And so, very, very, very important. And yeah, like you mentioned, it's one big club and we're not in it. And the biopharmaceutical complex controls a large number of things, and they do dictate, what happens seemingly globally, as most countries still administer these life-reducing injections, unfortunately.
Yeah.
And so, yeah, we got to start addressing that. And one way to do that, and one key way to do that, is by publishing research, as you have been doing. And so, I do definitely applaud you for your work. And I urge everybody to please go follow Raphael Lataster on social media. Can you give our audience your handles where they can follow you?
Yeah, so my brand, if you will, my little side project is OK Then News, OKAYTHENNEWS. So okthennews.com. That'll take you to my Substack. That's also my handle on Twitter. I set that up while I was working at the University of Sydney to identify areas where the media is basically lying to you, where they're getting things wrong, and politicians and so forth outright lying to you. And then COVID happens. It's basically all about COVID now, a little bit about Trump, a lot of lies being told about President Trump. But yeah, it's mostly COVID, seeing as such a big part of my life and everyone's life as well. So yeah, OK Then News, or just my name. I'm probably the only person in the world, I think, with my name. Very curious combination of names there. But OK Then News, that's pretty much it. That'll get you to the Substack and the Twitter page, or the X page.
All right, awesome. Well, thank you so much for joining us today.
Thank you very much for having me, and great stuff with your work as well. I'm keeping an eye on what you're doing too.
Thank you.